Bismillah ar-Rahman ar-Rahim. I want to share with you the information that I have presented today, my keynote presentation about clinical considerations in the patient-centered care in clinical practice, or the philosophy of patient-centered care in clinical practice, and as a new transformation in the healthcare system. In Dubai conference, its topic is nursing healthcare and patient safety conference in Dubai, which started yesterday and December 15th, and will continue to or till tomorrow, December 17th. And my presentation as a keynote speaker was today before more than 1 hour, and I finished my presentation. It was a very interesting topic about patient-centered care as a new transformation in the healthcare system process, and as a breakthrough, and also as a breakthrough and as a transformation in the clinical decision-making process in relation to what we call the problem-oriented approach to diagnosis and treatment in clinical practice, or to what we call also the diagnosis-oriented or symptom-oriented approach to clinical management. The concept of the patient-centered care is a new concept in the healthcare system, which shifts the role from what we call the physician-centered care, and the physician being the one who plays the dominant role in clinical decision-making, whether regarding diagnosis or treatment, on one side, to the current concept of patient-centered care, in which the patient plays the active role in deciding about the clinical action to be taken, whether during diagnosis or during treatment, maybe regarding the what diagnostic options we can use, what diagnostic procedures we can choose, and what therapeutic actions or therapeutic options we can start with or we can adopt for the case at every stage in the patient's journey, and during the evolution of the disease in cases of chronic diseases management, or patients suffering from chronic diseases and the chronic disabilities like diabetics, hypertensives, patients with dementia, patients with mental or psychiatric disorders, patients with chronic physical diseases like I mentioned, diabetes, hypertension, epilepsy, bronchial asthma, chronic heart disease, chronic kidney disease, chronic liver disease, whatever chronic medical disorders, and the role of the patient, the active participation of the patient in deciding about the clinical action to be taken regarding diagnosis or regarding choosing therapeutic option. This is what we call the patient-centered care. And here it is the basic principle of patient-centered care is paying attention and considering and respecting the patient's values, patient's preferences, and patient's needs, on the background of the patient's culture and the patient's beliefs, looking at these things and respecting its dignity and respecting the patient's privacy and beliefs and needs and the preferences and requirements in the healthcare process. This is patient-centered care, or the PCC. But of course, in order to apply this concept or new concept of the patient-centered care, we have to inform the patient. The patient should be informed, the patient should be educated, and the patient should be provided with the sufficient knowledge and sufficient information regarding his disease process and regarding what treatments we can use, whether drug therapy, whether radiation therapy, whether surgery, for example, in cancer patients, or using hormonal therapy or biological therapy or these things. This decision about which diagnostic procedures or which we can start to use as number one, and then we can use the other one after that, or what next we can move to or step forward to use it in diagnosis and in therapeutic, choosing therapeutic options, the best therapeutic options, what we can use now and then what we can use later, depending on the patient's requirements, depending on or respecting the patient's needs and preferences. Again, I mention and I confirm, after informing the patient as a consumer, as a healthcare consumer. This is very important. This is the patient-centered care, and it puts the patient at the center of this healthcare process triangle of the healthcare provider, who is the clinician or the nurse or the physician or the surgeon or the clinical pharmacist or whoever he is. This is the provider, and the consumer, who is the individual patient, and the healthcare authority. This is the triangle of the healthcare process. We put the patient at the center. We call it patient-centeredness in the healthcare process. This is the idea of the patient-centered care. But it has legal implications. It should be understood completely by all the parties in the partnership, because it is a partnership between the provider on one side and the consumer or the individual patient on the other side. The aim is to improve decisions and to improve what we call the individual health outcome, which at the end will help to improve the population health outcome. And of course, it has legal implications. It has implications on the business work in the medical profession or in the healthcare profession. It should be understood, and also its dimensions regarding, for example, the role of artificial intelligence in the applying the healthcare and applying the patient-centered care, or the PCC concept, in the healthcare process should be understood. What is the patient's experiences, and what is the patient digital preferences, and how can we train the patient on using the high tech in his or her deals and communication with the healthcare system to be implemented, and its role and its importance in the patient-centered care. It's related to many things in clinical practice and in the healthcare process. It is related to the law, and this is the legal aspects or the legal implications of patient-centered care, because it has legal problems. Of course, the physicians and the health carers and the health providers should understand its legal implications and should develop their communication skills with the patients, because miscommunication is the commonest cause of misunderstanding, which is the commonest reason for raising complaints against health carers and medical staff in relation to admitted medical errors or medical mistakes. All of these things should be understood before we apply the patient-centered care in any healthcare system, in any city or in any country. It has many shortcomings. It might have disadvantages. Exactly, we should understand its disadvantages, same like we understand its advantages and its uses and its importance in patient-centered care. We should know also its disadvantages and its shortcomings, because it might be applied wrongly or jokingly in some places, if not fully understood by the all sides of the partnership of the healthcare process, the providers and the consumers. So this is very important to understand, and I hope that all people could have benefited from my presentation today, and my best wishes to all of you. And I hope that I will meet with you in other scientific meetings and events soon, inshallah. Thank you so much. Have a good day.